Hello, welcome. Dr. Leah Mazzola here, founder and owner of YCI. I am so excited to get to spend some time today sharing all about the work that we get to do through coaching and the difference that we get to make. Here's our agenda. I'll tell you a little bit about myself first, and then I'll jump into defining coaching, sharing a little bit about coaching research and ensuring that you understand where coaching fits in the world, the audience it tends to be a fit for, and the types of coaching services that you might be able to offer. And then we'll close out with introducing you to YCI's theory and model, our approach to coaching, and the science that grounds our work. A quick note about me, just so that you understand why I have such a deep commitment to this work and why I'm so passionate about making it accessible to tweens, teens, and emerging adults. It directly relates to my personal experience, having grown up one of 7 kids in poverty in high-risk circumstances, experienced all 10 adverse childhood experiences growing up, lost siblings and cousins to homicide and suicide, sibling to a 20-year prison sentence, and spent my adolescence from the ages of 12 to 17 engaged in juvenile delinquency and heavy substance abuse, and happened to make it to the age of 17, where many of those who I'd lost before lost their lives by the age of 16 or went into prison by 16. So making it to 17 was a pretty pivotal moment for me. I had this moment of just pausing to reflect and consider that I knew how the way that I was living turned out, and maybe I just needed to try something different. So I made a decision in that moment. It was through self-reflection and pausing to choose that I decided I was going to try another way. And it only took that single choice. That single choice led to me doing things very differently from that point forward, which is what allowed me to create the pathway to the life that I live today. My life as an adult is polar opposite from the life that I grew up in. I've successfully broken the cycles of poverty, criminality, and abuse for my own kids. And I did all of that through agency, ownership, and intentional action. So all of that started for me at 17, 5 years down the line, paused to recognize that I had been successful and was living this whole other life that I never thought was possible. So I, again, paused to reflect, to consider how I was able to make it out and why so many had not, and decided to go back to school. So I pursued all of my higher education with an interest in understanding why I was able to be successful and how to support others to make those changes in their lives too. And it was through researching that in my psychology studies that I found coaching. And when I found coaching and started working with my first teen client who was trying to make her own positive changes at 16, it just clicked like nothing else. It was the most beautiful alignment that I've ever experienced in my life. It was getting to have deep conversations with people about figuring out what was in their power to do what they needed to do to make the changes that they wanted to see. And that is it. That is like my whole ethos, learning and growth, and empowering the individual to do what they can, where they are with what they have, to begin creating the path toward where they want to be, and to learn how to leverage their internal and external resources more effectively so that they can get there more efficiently. So that's what I get to do with my time now. All of my work is focused on merging psychology and coaching to deliver evidence-based coaching and to promote creating awareness and facilitating learning and growth for everyone who I get to connect with in this space. I am absolutely in love with this work. I have never experienced any other work that I have fallen in love with in this way, and I am ecstatic every time that I get to share it with someone like you. So I appreciate your presence and engagement. This is my family. That's my husband. Those are our kids. We have 3 boys who are 23, 23, and 22, and a daughter who is 13. I love hiking. So that's a picture of me on a recent hike that was just absolutely mind-blowing. And that is 16-year-old Leah at the height of her delinquency and substance abuse, and 34-year-old Dr. Leah after receiving her doctorate, after having worked on her education for 9 years straight, full-time, around full-time work, raising 4 thriving kids with my husband. Quantum change is possible, and we are here to support it. Okay, so what is coaching? This is actually one of the #1 things that you are going to need to get comfortable explaining, because most people do not know what coaching is or how it can benefit them. So when you enter this work, you become an advocate for the work and you become an educator about the work. These definitions come from our professional associations, the International Coaching Federation, the Center for Credentialing and Education, and the National Board for Health and Wellness Coaching are 3 in the United States who basically serve as governing bodies. Since coaching is not currently regulated by law in the United States, we can turn to these professional associations that set ethical and professional standards, identify our practical skills that guide our scope of practice, and accredit training programs like ours, and provide board credentialing, which is higher credentialing for those who are committed to this work and want to pursue those. Our Certified Youth Resilience Coach training program is currently accredited by the International Coaching Federation and the Center for Credentialing and Education. Our Coaching Adolescents Continuing Education program is currently approved as continuing education through the National Board for Health and Wellness Coaching. So here are the definitions. The International Coaching Federation defines coaching as partnering with clients in a thought-provoking and creative process that inspires them to maximize their personal and professional potential. The Center for Credentialing and Education states coaching is a career in which professionals have specialized education, training, and experience to assess needs of clients, collaborate with clients on solutions, and offer strategies that assist individuals and organizations in reaching identified goals. And then the National Board for Health and Wellness Coaching states that health and wellness coaches partner with clients seeking self-directed, lasting changes aligned with their values, which promote health and wellness and thereby enhance well-being. And I'm going to draw your attention to some of the key differences here. We're going to talk about the differences between directive, guiding, and non-directive coaching approaches, and which of the definitions or approaches that you practice within is going to vary depending on which accredited training program that you're completing and being trained in, and or the context where you're coaching, and or which is going to be a better fit for the needs of your audience. The International Coaching Federation's ethics and core competencies are much more aligned with the pure non-directive coaching approach. If you look at their pass-fail criteria for their evaluated coaching sessions, you'll see that the coach sharing knowledge or their own opinions is fail criteria, but that is when the coach is primarily sharing knowledge or opinions or giving advice. So it doesn't state that you can't, it just says that if you are primarily doing that, that you are not coaching, which is aligned with coaching generally. The coaching approach is primarily non-directive, which we'll learn about shortly. However, the Center for Credentialing and Education and the National Board for Health and Wellness Coaching are more aligned with an evidence-based coaching approach, which is where the coach is integrating knowledge and or use of activities and or offering solutions when it fits for the needs and goals of the client as a primary function of our role as a coach. So we absolutely do those things. It's just a matter of fit for the client, context where you're coaching, and your level of training and qualifications to do any of those things. And again, we'll talk more about that shortly. All right, so coaching has been around since the 1800s. Earliest uses were to enhance performance in sports and debate. It moved into the workplace to improve performance and processes in the 1930s. And then the expansion to professional coaching today started in the 60s and 70s with the human potential movement. And this is a list of some highlights of coaching research. It's one of my favorite things to do, to dig into the literature, to just see the impact that we're making. And I'm going to read through this list. It's a long one. But while I'm reading through it, I challenge you to consider how vital these skills are just to a human generally, but then consider, had you had these as a tween, teen or emerging adult, how different might your life have been? So coaching has been found to increase cognitive hardiness, engagement, well-being, and hope. Coping skills, self-awareness, self-efficacy, self-regulation, motivation, stress identification, goal setting, goal striving, and goal attainment. Metacognition, self-evaluation, organization, elaboration, study management, anxiety control, and self-confidence, wellness, physical health, life goal attainment, high intervention acceptance, and healthy behavior changes, stress management and problem solving, study and learning strategies, self-esteem, school and work satisfaction, foresight, social connection, emotional regulation, resilience, life satisfaction, purpose, and meaning. And let's just pause to take in how important these things are to our quality of life and wellness as you're considering how worthwhile it is to invest your time into this type of a training program to develop these skills. It is highly worth your time. Coaching has been found to decrease mental health symptoms, distress, school burnout, anxiety, depression, and stress. And here are some findings specific to coaching in higher education, since that is a primary way that coaching is currently applied as a resource for emerging adults. And when we're thinking about expanding access to young people, them having access to this type of a service in their school where they already need to show up is paramount. So yes, let's please spread this into all schools, colleges, and universities. Academic coaching improves academic performance and retention, goal setting and achievement, a renewed focus on goals, self-awareness, and strategies to avoid stress and burnout, motivation and self-efficacy, alleviates educational stress, it builds self-confidence and skills, including time management and stress management, prioritizing and note-taking, increases mental well-being, and improves personal relationships and financial management, all vital life skills to thriving. All right. Our focus at YCI is evidence-based coaching, and that is defined as the intelligent and conscientious use of best current knowledge integrated with practitioner expertise in making decisions about how to deliver coaching to individual coaching clients and in designing and teaching coach training programs. This is a visual by coaching psychologist Tony Grant that explains evidence-based coaching. His 2x2 framework shows the approach combines professional wisdom and empirical evidence. Professional wisdom includes the individual's experience and group consensus. And if we think about the ICF, the CCE, and the NBC-HWC, those are professional associations that are developing those ethical and professional standards based on group consensus that is developed from the individual experience of professional coaches who have been doing this work for a long time with clients in various contexts and are contributing to the group consensus to develop those professional standards and ethical codes. And that empirical evidence includes coaching specific research and coaching relevant research. Your coaching specific research are studies designed to investigate coaching and its impacts like those that we just reviewed. And coaching relevant research includes knowledge bases like psychology, education, or management that are specific to the specialized needs and goals that our clients are coming in to address. And all of YCI's programs are developed through a combination of both, and we are die-hard evidence-based coaching approach here. All right, and then this is one of the easiest ways that I have found to describe the difference between coaching and therapy during consultations. This is another primary distinction that you'll need to be able to explain during your initial conversations. This is one of the things that people are really confused about, and coaching is not a substitute for therapy. So let's throw that out there first. Coaching is a very specific type of service that is a fit for a functional enough client who is able to engage in the coaching process. So if you think of wellness on a continuum, you have 0 as normal functioning, the dysfunction and the negative numbers, and thriving in the positive numbers. Therapists work with people who are experiencing moderate to severe levels of dysfunction. So they may be experiencing symptoms, illness, or crisis that is interfering with their ability to function normally. And they can use the therapist's support to help to bring them back to functional enough and or their normal. Coaches work with people who are functional enough to act as agents in their own life, to use their critical thinking, their ability to brainstorm and generate potential solutions, and to collaborate with the coach to figure things out. The coach works with that client who's able to carry most of the cognitive load in a session, and or at least half of the cognitive load in a session, to collaborate and problem solve together and find solutions so that person can get out into the world and take those actions to make things happen, to move themselves further into the positive numbers toward thriving. So coaching is all about supporting people as they use their resources to figure out what needs to be done, to get out there and do the work between sessions, to make the progress that they want to see. That requires a person who is ready, willing, or able to engage in the coaching experience. Not everyone is there. So those who are not there can work with a therapist to get them to that point, and coaching can pick up from there to support them as they continue to make their positive progress. I've already mentioned that a key feature of the coaching approach is it is primarily non-directive. That's where we are facilitating the client's process rather than getting into the work with them to help them do it. If you see that directing to following continuum, pure directive interventions are all the way on the left there. You have your examples as a teacher, a mentor, or a consultant. In that situation, the service provider is the expert, and or the person with the lived experience is coming in to share that experience so that they can basically shine the light on, this is what you need to do, or this is how we got here, or this is how you could get there. So with the directive approaches, you have telling, advising, sharing opinions, giving solutions, where that is primarily what that person is doing because that's what they're there for. Whereas with the non-directive approaches, we're there to be a facilitator to support the person as they build their internal skills to be able to figure things out for themselves. So we are doing more listening, inquiring, reflecting. We're supporting them as they develop their own solutions. We are supporting them as they build their skills for metacognition, their critical thinking, their creativity, their sense of curiosity, discovery, exploring, their willingness to just brainstorm and figure out which of these things makes the most sense based on whatever it is that they're working on and the progress that they want to see, and being willing to own the decision of what they're going to pick to try, figure out the strategy of how they're going to apply that, make the commitment to get it done, get out there, take the action, come back in, reflect on it, see what happens. It is very much an experiential learning approach in that full non-directive coaching approach. That purely non-directive approach is considered person-centered coaching. That is one type of coaching that could be a fit for a particular audience. Now, the guiding approach is in the middle. That's where there's more of a collaborative approach in the process. They're both seen as experts. You have motivational interviewing here and evidence-based coaching there in that space. YCI dials back and forth between guiding and following generally in our coaching approach. And the guiding is where we are still using our non-directive coaching skills, listening, inquiring, reflecting. But there's also an element of information sharing with permission. So this is where we're noticing that the person may have a gap in their knowledge, where we have expertise or awareness of something that they're not just going to figure out on their own because it's very specific. So for instance, if they're here to work on increasing their motivation and you are aware of the science of motivation and how intrinsic and extrinsic motivation work and how they influence our behavior. First, we're listening for what they know about that. If we're not hearing anything and it seems like it could be helpful to their process, we would just check in with them. What do you know about the differences between internal and external motivation? And we're not assuming that they don't know. So we're asking, we're checking in. If they do know something, we ask what they know, and then we help them to use that knowledge to apply it to the situation. If they don't know, then we are offering to share more information. It can be something like, a lot of my clients have found it really helpful to understand the differences between those two types of motivation and how they affect us. I'm wondering if you would be open to me sharing a little bit about that, and maybe even working through a quick activity just to see where you are on it and how it could be helpful. And they say yes or no. If they're willing to hear us out and go through the activity, then we do that. And if they're not, then we're okay with that. It's an offering, not a requirement. So we are offering to share the information if it could be helpful, if they're willing to hear it. But if they're not, then that's okay too. We just move on. The other thing is, when we do start to integrate knowledge and activities, it's important for us to stay in our coaching presence and mindset. So we're not shifting into a full-on lecture. We are sharing quick bits of information as it could be helpful just to enhance their awareness and understanding. We're not trying to teach them to a test. So we want to ensure that we're just sharing bits and then coaching them to apply that to their situation. We're not taking over the session by shifting into full-on professor mode. All right, here are some considerations of the differences in these approaches and where they make the most sense based on the client's needs and goals and the qualifications of the coach providing the service. So you see here on the sides that the goal urgency, severity, complexity, or precision required matter to which approach is going to fit. The coach's level of expertise and qualifications to share knowledge also matter. The current state of the individual's prior knowledge, cognitive development, capacity, or functioning matter. When we're identifying which approach to use, we very often don't have enough information about who the person is and what they're capable of or what they know until we dig into the work. So my strategy is a least to most intrusive approach, which is beginning purely non-directive and then dialing toward guiding and or more directive if and when it fits based on the needs of the client in session and what I'm learning about who they are, what they're capable of, and how much support makes sense. So when we're dialing back and forth, we're doing that responsively based on how the client is engaging, what we're observing, and what it seems like they need. And when we're dialing more toward the guiding approach, what we're doing is basically we're adding more scaffolding just a little bit at a time until they get to a point where they're able to engage effectively with us in the coaching process. So keep that in mind. We're going to talk about scaffolding more in a bit. Let me give you some examples when we're considering capacity or functioning. So let's say we've been providing academic coaching for a senior in high school, and they are experiencing school burnout, but they are now in severe burnout and they're in a state where they're experiencing a lot of brain fog. They're having difficulty with thinking clearly or using their brainstorming or accessing their creativity to be able to generate possibilities or use their critical thinking to determine which could make the most sense and where to go from here. So because of their current state of burnout, which is resulting in these symptoms, brain fog, they need the coach to carry more of the cognitive load. They need more guidance and more support with identifying solutions that could fit for them now. So this is where, when this person is in this state, the severity of the state that they're in and the limitations around their functioning mean that they don't need us to sit on the other side of a conversation and ask them what ideas they can generate. They need us to sit on the other side of that conversation and recognize that they are unable to access those faculties and to step in with, this is what I know about school burnout. This is what I know about evidence-based solutions. Which of these would you like to try? And if they can't even choose in that scenario, it could also be our using what we know about them and their situation to support our guiding them to the solutions that seem like they could be the best fit for them in this moment based on what we know. And then that conversation would also turn into considering getting them connected with higher levels of support. So it may be important for them to connect with a therapist, to get some counseling at this point, and or to get connected with other support resources in their network to address the social or systemic issues that are contributing to the burnout that they're experiencing. There are a few types of coaching where integrating mentoring and teaching are regular parts of the experience. And those are going to be things like academic coaching, recovery coaching, leadership coaching, parent coaching. In those scenarios, when we are integrating those more directive approaches, we're still staying in our coaching mindset and presence, believing that this person is naturally capable, resourceful, and whole, and simply stepping into more collaboration where we're sharing more of our expertise because the goals that the client is working on are high stakes, and sharing specialized knowledge or experience in those situations can alleviate a lot of distress and expedite their finding and applying solutions that work to reduce the likelihood of negative outcomes. So if we think about a young person who's struggling with substance abuse, the recovery research actually shows that having near peer mentors who've had similar experiences and or even older mentors who have had similar experiences supporting them in their recovery is highly effective. And in that case, the person sharing their lived experience is one of the primary ways that they're able to make an impact, because the person who's working on their recovery is able to make a connection with someone who has already been there and done that and made that positive transformation, although it was very difficult. So that mentoring is a key element of something like that. That mentoring is also a key element of supporting college or university students in higher education when they're a first generation college student, or if they're an underrepresented student. Integrating mentoring into the academic coaching approach is highly effective when they're able to work with coaches who have similar lived experience to them. And those coaches are able to serve as a role model, demonstrating what's possible. Now, when you're thinking about evidence-based coaching and using more of a guiding and directive approach, it is important for the coach to have some level of expertise in those specialized areas to be able to offer those approaches well. Someone with a degree in education could offer academic coaching really well. They're able to combine their knowledge of teaching and learning with their coaching skills to offer this specialized service for students. Someone who has a degree in psychology could combine that knowledge with coaching skills to provide mental health coaching really well. Someone with a health-related degree could combine that with their coaching skills to provide health and wellness coaching well. Even if you don't have a formal degree in any of those specialized areas, you can pursue courses to gain that specialized knowledge and or additional continuing education in those areas to combine those things. So key is really to identify what are the core areas that you really want to be able to support young people to address through coaching, and then checking in with yourself on what expertise are you already offering based on your lived experience and or formal education. If there's continuing education that you can do to become more equipped in that area to offer all three of these types of interventions, go for it. We are here for lifelong learning. Continuing our professional development is absolutely part of serving our clients well. Our programs are giving you specialized knowledge to promote adolescent resilience, well-being, and health. So you can absolutely support any of those areas very well just by completing our training programs and remaining in your study around all of the knowledge that we're sharing. All right, there are three primary ways to apply your coaching skills: through person-centered coaching, which I also refer to as organic coaching, evidence-based coaching, and a coaching program. And fit for these are the same as the other slide, but that person-centered coaching is is coaching in its purest form. I call it organic coaching because in that the coach is showing up empty and we are simply asking the client to set the goal for the session. We're facilitating their process through the session based on whatever arises in the moment. And we have no predetermined agenda for them. We are there to support their agenda in that space. In evidence-based coaching, we have the client choosing the focus, but we are using additional scaffolds in the service to support promoting the outcomes that they're seeking. And that's where the guiding approach comes in. The client stating, I want to work on motivation. And if we have expertise in motivation and or activities that we can use or knowledge we can share about motivation, we're bringing that knowledge in, sharing those activities, and using those additional scaffolds to promote it. Those are evidence-based because we're not just making that stuff up. We're going and scouring the literature to identify what does the research say about motivation and effective interventions. And then we are developing coaching appropriate tools to be able to integrate that stuff to promote those outcomes for the client. And that is what our approach is. That's what we're training you in. That is all the knowledge you're going to be gaining here to be able to do that thing. With the coaching program, you have preset coaching focus areas that are informed by the research of the client's needs and goals. So in those first two tiers, the client is coming in and they are choosing their own goals for the coaching engagement. And the coach is supporting their progress around those chosen goals. The coach has no preset goals. But in a coaching program, that is not the case. With the coaching program, the coach or the organization, wherever it is that the service is being delivered, has done their research to identify these are common needs and goals that my audience comes to me to address, or these are common needs and goals that I want to be able to support. So I go and do my research to understand how to promote positive outcomes in those areas. I learned through the research that it's these ABCD things that we need to attend to be able to get this outcome. So I create a coaching program that is promoting those ABCD things. For instance, the trainees who go through our Certified Youth Resilience Coach program, they get a free license to be able to use our pre-developed resilience coaching program. It is designed as a 10 or 11 week coaching engagement that involves a once weekly workshop where the coach is teaching the clients evidence-based strategies to build resilience. So each week has predetermined focus areas based on the resilience research. So one is about self-awareness, one is about stress management, one is about internal motivation, things like that. And then there's also a one-on-one coaching session where you now ask the client to pick from one of the topics that you talked about during the workshop, and you coach them through integrating that thing into their life. So in that case, the client still has a choice to either engage in the coaching program or not. We're not taking away their power to choose. So when they are coming in to sign up for coaching, they have an option to sign up for this coaching program or to do pure one-on-one organic coaching or evidence-based coaching in another way. So you're explaining which services you're offering. Some places only offer coaching programs. Whatever the case, when they come in looking for the service, they're going to be able to choose to engage in the coaching program. If they sign up and say, yes, I want to do this thing, that is their agreement at the opening. They're agreeing to work on these goals and to following the focus areas that were already pre-developed rather than choosing their own goals. We're still promoting the client's sense of agency, their power to choose, but the coaching program is designed to promote these very specific outcomes that the client is coming in saying that they want to achieve. The coaching program offering is actually what you'll find delivered within large coaching organizations and or schools, because it's the most powerful way that we can promote these outcomes more efficiently and effectively by just going into the research and delivering it in the way that has already been found to be effective. So which of the services that you offer is going to depend on who you're coaching, where you're coaching. Those who go through our Certified Youth Resilience Coach training are learning to deliver all three of these services. Those who are going through our Certified Youth Wellbeing Coach training are just learning that first tier, the person-centered coaching. And that is because person-centered coaching is the hardest thing to learn. That is where you are purely using your coaching mindset and presence and coaching skills to facilitate the client's process so that they can make the progress that they want to see. And the pure non-directive approach is not our natural way of engaging in the world. So it is the most challenging thing to develop. It's a habit change process. It is a behavior change process. It takes time to develop that skill set. It will not happen overnight. You will need to continuously practice, and it will stick with practice and repetition. Once you get to that place where you're able to sit in your coaching presence, shift into your coaching mindset, and remain there with clients, you'll know that you are ready to begin to integrate these higher level skills of evidence-based coaching and coaching programs without losing your coaching presence. It is challenging to do that because as soon as we start to shift into offering solutions, it's a slippery slope where it's really easy to get all the way back to directive interactions unnecessarily. And remember that our non-directive to directive thing is about being responsive to the needs of the client rather than just going off of our preference or habit. It's important for us to be able to make professional decisions about what is the best fit for the client and to be able to self-manage to remain in whichever of the approaches is fitting. So most of the demos that you're going to be watching throughout the training program are demonstrating the person-centered approach. Most of the practice that you're going to be going through in our practice breakouts initially will be focused on the person-centered approach so that we can get you to the point where you're able to use that skill set well, and then we'll begin to ingrain the evidence-based coaching thing down the line. And I'm sure that educators will be able to appreciate this insight into where coaching fits on the education continuum when supporting learning and growth. This matters to all coaches because our primary function is to create awareness for the sake of facilitating learning and growth. So that's our whole job. If you think about the education continuum, you have pedagogy, andragogy to heutagogy, and the fit for each of these is going to vary based on the learner, what they already know, their needs, and what it is that they're trying to learn. And you see that you have learner maturity, autonomy, and cognitive development required as factors to determine which of these is going to be the best fit. And that influences the level of instructor control and course structuring required. So pedagogy is that passive information intake. This is where you know nothing about this thing or very little about this thing. So someone is telling you all about it, like I'm doing right now. And that's really helpful if we don't know anything about it because, hey, please share everything I need to know so that I can get started and figure it out from there. Andragogy is the project-based or experiential learning approach. It's where knowledge is going both ways, where there's more of a collaboration involved, and the person is building skills. With heutagogy, that's where the learner is leading the experience. So in that situation, the learner is choosing what they want to learn. They are driven by their own curiosities, problems that they want to solve. They're brainstorming, researching, figuring things out, and coming back to share what they've learned with the teacher. So in that situation, even in an educational environment, the teacher is the coach, learning from the student. The student is coming back to share what they've learned, and they're growing together. So if you think about this from a coaching perspective, the person-centered non-directive approach is a heutagogy approach, where we are simply facilitating the client's process as they identify their own problems that they want to solve, the goals that they want to achieve for themselves, what they want to learn, how they want to explore that, what they want to try. We're supporting their self-discovery and their development of their internal skills. And then in the evidence-based coaching approach, that's the guiding thing. That's andragogy. That's where we're both in the mix, both throwing ideas into the bucket, collaborating in the process, figuring out what makes most sense together, and both learning on the way. We are not going to get into the pedagogy thing within the coaching realm. That's a pure teacher mode thing. that we are not doing as a coach. As a coach, we are either primarily non-directive or getting at most to a 50-50 split on the non-directive thing, which is more of a guiding approach. All right, and here is an overview of core coaching competencies. I'm sharing this just to give you an idea of what we do and how we do it. And we get into this all in detail, very in depth throughout the training program, but this just gives you an idea of what it is that you're signing up to learn. And you can kind of gauge, does this seem to fit with who I am and how I operate in the world, or how I want to be able to operate in the world, and the type of engagement that I want to be able to promote? And hopefully it does, but it may not, and that's okay. I'm sharing these because as a level 1 accredited program through the International Coaching Federation, our primary focus is to train you to coach to their standards. The basic coaching skills that you're learning are their core competencies. The evaluations that we are training you to pass are their final exam standards. So by the time you finish our Certified Youth Resilience Coach training, if you're going that far, you will be coaching at the ICF's ACC level. We begin by demonstrating ethical practice, which is all about staying in our scope as coaches. And one of the elements of ethical practice is attending to sensitivity to the client's identity, environment, experiences, values, and beliefs. It is key to understand that we are promoting accepting the client as they are, receiving them as who they are, supporting them as who they are, and promoting their sense of mattering and belonging as they are. The coaching mindset is open, curious, flexible, and client-centered. We partner with the client to identify what they want to accomplish through the coaching engagement. And during each session, we are promoting them identifying self-chosen goals. We work to create a safe and supportive environment that allows the client to share freely. Maintaining a non-judgmental space is core to that process. We work to remain focused, observant, empathetic, and responsive to the client. We listen more than we speak. That's a big one that we generally have to work really hard to build in as a skill. We work to facilitate the client's insight and learning by using tools and techniques like powerful questioning, silence, reflections, and metaphor. We partner with the client to transform learning and insight into action, and promote the client's autonomy in the coaching process. And if all of that sounds very aligned for who you are and the difference you want to make in the world, you are absolutely in the right place. You get to learn more about that place next.